Welcome to the QEM Heroes webinar series. My name is Christine Wood, and I serve as the Assistant Program Director for the Heroes Fellows Program at QEM. And for more than 30 years, QEM has been a national catalyst for STEM education transformation and research capacity building. Currently, the QEM network serves nearly 900 colleges and universities and reaches more than 8,000 individuals nationwide. This webinar is part of the HEROES initiative. The HEROES program brings together researchers with experience in the federal government to lend their expertise and support to the STEM research and education communities. Our fellows are here to provide tools and tips for navigating the funding landscape, developing STEM programs and partnerships, and improving talent retention in in-demand fields. We hope this series promotes engagement with our HEROES fellows and provides valuable resources to our participants. During the webinar, we invite you to use the Q&A tool to ask questions, and we'll address those questions at the end of the presentation. And the webinar recordings and slides will be available in the QEM Resource Hub. By attending this webinar, you will be added to the QEM network and granted access to the hub. And I'm so proud to introduce our presenter today. Dr. Amaka Nwankwo is a global public health executive and epidemiologist with more than 25 years of leadership advancing HIV/AIDS programs, health systems, and equity-centered policy across Africa, the Caribbean, Southeast Asia, and the United States. She most recently served as Senior HIV Technical Advisor and Acting Office Director for USAID in Ho Chi Minh City, Vietnam. Dr. Nwankwo brings expertise in TA science and epidemiology, strategic information, and cross-sector partnerships, complemented by experience as a teacher, lecturer, and mental health coach trainer. She holds a Doctor of Public Health and Global Health Epidemiology from Morgan State and degrees in Education and Chemistry from Temple. So welcome, Dr. Nwankwo, and I'll turn the floor over to you.
Thank you so much, Christine, and thank you all for joining us this afternoon. I appreciate the introduction. And today's conversation, and hopefully it will be a conversation, is really about taking another look at some commonalities in the fields of public health and STEM and using that to increase the opportunity for leadership, as well as the importance of the urgency and nature of healthcare in today's world. And allow me to pull up the slide deck for everyone. Okay. I could just get one thumbs up if we see the slide.
There we go. All set.
Okay, I think there's a little delay. Okay, got it. Thank you for your patience, everyone. So today's conversation is about advancing public health through leadership and through STEM. And why this came to mind, and this is something that I'm always sort of thinking of because I live in this space on a daily basis, both in a professional level and in many ways in a personal level as well. But I feel like we need to join and align a little bit better, both at the research and institutional level. But I'd also like us to consider just our personal take on what is public health and what is STEM and where and when did the two conjoin. So that will be our conversation today. And some of the objectives are to look at the role of STEM in public health and leadership. Again, thinking of ourselves and our work as connectors and bridgers to data and decision making, what that means from a public health perspective and approach, and what that equally means from a STEM, science, technology, education, and math approach as well. Also reviewing some institutional pathways. So maybe many of our partners, as well as our collaborators today and within the QEM network, are representing different institutions. And so whether you're from the health or the science side or the STEM side, what does that mean in terms of how to navigate that space within your institutions? And then maybe we can consider some actionable strategies and steps that you all can take with you and maybe have this conversation in smaller levels within your circles, but then also from QEM, from the heroes, and maybe I can get some of my fellow heroes that are STEM advocates as well as health advocates engaged in some of the work we'll do potentially together in the future. So some opening questions for you. What does a public health leader look like in 2026? And here we can use the chat. The chat is open, correct, Christine?
Chat is open for everyone.
Thank you so much. What does a public health leader look like? I'm just looking for some words. What do you hope they look like if they don't look this way in your own communities and your own purview? A public health leader looks like X. Can I get some some views in the chat. And if you're able to see and monitor the chat with me, Christine, that would help too as the answers come in.
Yes, of course.
Anything, anyone? Are they doctors? Are they nurses? Are they merely only clinicians, a public health leader? Are they politicians? Some responses, like thank you for those that are starting to come in.
We have supports equity to access for healthcare.
I love that. Thank you, Carrie. Someone that supports equity. And what does health equity look like and access to care in various ways? All of that. Thank you, April. All of that, exactly. But I think, we may have frames of thoughts from individuals that believe a public health person is a lay person on the ground. I love that. A community leader, a community health person within in their various spectrum. My daughter, awesome, April. We could talk offline about your daughter and her work in public health. Public health leader looks like me, looks like you. Actually, you may not consider yourself in that vein, but we are all governors of our own individual health, right? And so we have to lead our own perspective. But I'm thinking on a systems level what that person looks like. There's an old perspective that public health leaders are merely clinicians only. And I don't want to believe that anyone here has that individual myopic sort of view, but that there are many different guises and looks to a person that works in public health. And we can get into that a little bit more. But the other opening question is then, what is a STEM leader? Who is a STEM leader? Can I get some feedback maybe in the chat as well? Anyone? Merely a scientist, a researcher, bench lab person, life sciences only? Who's a STEM leader? A technologist, all levels of engineering? Is it specific engineering that really lends itself to STEM? What I'm trying to do here is really show that public health and STEM have more in common than otherwise. In fact, public health can't exist without the STEM, without the science, without the engineering for the technology that's involved at either the clinical level or the hospital level. Mathematics, obviously. So we're always looking at things in terms of anything from how we count the number of pills that one must take for an ailment or illnesses. Love it, April. Thank you. Not only your daughter, but your sister. Your daughter's a newbie. Thanks for sharing that. And she's in high school. I love that she's already exploring the connections between STEM and psychology and biology. I ask this because maybe 20 years ago, I wouldn't have even called myself a STEM leader per se. Though I came from a science background and I translated that into a public health career through the sciences as well, I think I merely saw myself as only in the public health space and lane. And then I started teaching, and there's some other things. Let's move to the next slide. My journey. I was a secondary school teacher. I taught science at the middle school level, immediately finishing university, and then I also taught chemistry at the high school level. It took lots of prayer, but in that there was a lot of great discussion about science. But I had studied a core science and then moved into the healthcare space and found myself within the school and using many examples from public health and from that area in our science classes, in our STEM classes. But I've also gone on and done a lot of public health work here in the United States, working in hospitals, in the community, et cetera, and have found a really sweet spot, for me anyway, between science and STEM and public health. That led to overseas work and global health leadership. Christine already mentioned epidemiology. I love that now in 2026, if I say epidemiology, it's not a scary word. So COVID did have some positivity, and that is people became more familiar with the study of diseases, science, and data in the public health space, which is what epidemiology is. And I mostly did infectious diseases, HIV, malaria, tuberculosis, and things of that nature, and had the benefit of also doing that on behalf of the US government. And what I really found is really there's this process that we really need to consider. And that is how do we move from data to policy to real system reform? And that finds itself in every space, I would like to say, not just the public health space. This is where I found a lot of the work needed to be done. Of course, we know that data abounds. Okay, so we're at no risk of not having enough information. But what do we do with that? And how does that translate into policies, equitable policies, and system reform? So I'd like for us to consider this action framework that we sort of put together and what I was just saying in terms of how to move from data to insight to policy to the real crux here is really the impact. So we have all this information, we have data from everything that we do, not just in a day-to-day basis, but from a public health perspective and from a science perspective. We have a lot of information about how we collect accurate information about ourselves. And it's so diverse and plentiful that we are really never going to have a problem with using this information. But how we do it, I think, this it's in the how we do it is really where we can really find some insight, moving us sort of to the next step. How to analyze and interpret that information so that we uncover trends and patterns and actionable steps that we can use. And while I come from a public health space, I think we also need to think of the science and the STEM space. What does that mean for someone sitting, for example, at the university level? Whether it's at the undergrad, administrative, or at the graduate level. That insight can really help us move things in our individual communities as well as within our institutions. And I'll get to that in a moment. But the next step, I think, and it's not linear, but we also need to look at policy. So, how do we translate this information into evidence based strategic decisions that are made from a small level to a population level, which is where public health sits. And then finally, but certainly not the end, but the impact. What does it mean? I think we are at a place in our country where we really have urgency and to ensure that we're moving along and ensuring that individuals as well as collective communities are able to see, implement, evaluate, as well as refine the processes that exist. Many systems are broken, and what that means and what that looks like will take you and I and those of us in many different spaces to help that improve. So going back to institutions, and so I want to sort of bring this back home from the QEM Heroes Fellowship space, and that's we're looking to help and assist and add to the conversation for various institutions, and particularly HBCUs and minority serving institutions. But we have to consider the pipeline. What's the pipeline of leadership development? And we can go into that a little bit more, but I'm talking about where we start from a curriculum perspective, our collaborations and collaborators, funding, and definitely faculty development. I think staying in one lane, in the public health lane, there's always a domain. We know where to go. We've had our usual suspects of where to ascertain where funding might be coming from, though that landscape is also changing in the current space that we're in. But then similarly for STEM, I mean, we can look at various government agencies and entities, but I think we need to move into what does this mean from a community perspective? What does it mean from a philanthropic perspective as well? And then getting our leadership, faculty, admin, and even our students to see that these are important factors that need to be considered in the work that we do in the day-to-day basis. So some questions for you. And please, again, we're using the chat. How can your institution advance STEM leadership? And are there gaps that need to be developed and addressed? So here's where we use the chat, folks. This is going to be the collaborative part of our conversation. Hopefully, that will lead to a discussion. And I can't say exactly. We have about 20 plus persons, so we could even come off mute if the chat becomes a bit much. But I'm trying to get us to think about the leadership. So starting at the top, to even see something like STEM and public health collaboratively working together. And what your institutions or wherever you're coming from, whatever space, community space, and other organizations might develop that leadership or address the gaps if they exist. So in STEM, I think, again, people are in their lanes, right? You have your life sciences. They are applying for certain funding from anywhere from National Science Foundation to maybe even NIH if they're looking at the public health space. But then where are the gaps? Are these areas and divisions within the institutions even working together? Thank you for some of the feedback from the chat in terms of making sure that faculty are up to speed on AI capabilities as well as how they can integrate into classroom discussions. Thank you for that, April. Absolutely. And Gilbert, formalized a national HBCU STEM network. So these networks exist, but are they talking to each other? And are they bringing in things like health into the conversation? I did a little bit of research in preparing for this and wanted to see what were the STEM and STEM adjacent collaborations that are already taking place. So we know STEAM, adding the arts. I think we've also seen research, we've seen STREAM entered into STEM as well. But I didn't see anywhere where there was a adjacent to public health, and I thought that's so odd. In my mind, anyway, I come from that space, and I been doing this and have colleagues that have equally done the same, but we don't have a formalized space, to your point, Gilbert, within looking at HBCUs, STEM, and public health and healthcare. Any other feedback? Are there gaps at your current institutions or in your purview for the work that you might do in viewing this webinar? Are there leadership gaps that need to be addressed in order to strengthen the systems? Does anyone's institution currently have a science and healthcare, public health, maybe even medicine, if we want to just go to that level, even though it's different from public health, that currently work together, that apply for grants or funding together, that have either some kind of working group or a meeting where they discuss these types of things? I'm going to say that it's probably less likely in many institutions. I think everyone sort of tends to stay in their own lanes. If I come from a government perspective, I worked at Health and Human Services, and then I also worked for some of the aid organizations, USAID, as well as the State Department, and very rarely were we talking to each other. Even if we had working boards and community boards as well, very rarely did we know what was happening in the STEM field. And maybe a few of us would have these conversations or curiosities about how to work together or in tandem in these two areas, but it did not happen organically or naturally. Thank you for the comment as well, April, in terms of psychology, and could be aware of, yes, of things like that are happening in the biotechnology space and help with diagnosis and, prediction of different health abnormalities or episodes. Absolutely. I think they're rubbing shoulders a little bit more. I would say certainly science is there, right? The technology is advancing quickly. Engineering and math, as we know it from a STEM perspective, probably still some gaps to be addressed. Certainly educational gaps and leadership gaps. But I think the technology, as you're mentioning right here as well, April, is definitely coming up. Things like wearables, looking at biomarkers, matching and aligning in terms of the science and the technology, in terms of equipment is certainly happening. But the technology has been a part of the NASA regiment. Thank you for adding that, and the military battlefield, but needs to spin off into absolutely into the general population, which is why we're having this conversation today. Thanks for that, April. And then thanks, Gilbert. I see that you mentioned here currently at Lane College and Lemoyne Owen College. They're doing not currently, thank you. They're not really aligning from your perspective where you sit in terms of looking at institutional work behind STEM and public health. So we're not at closing. I wanted us to also consider what's being done in terms of watching what's happening in our current health systems. Last week, for example, was Black Maternal Health Week. And so we've seen, I think, a lot from media, social media, what's happening within our health system, especially amongst Black and Brown people, and then specifically looking at women's health as an example. As an example, public health is there at the core from the beginning in terms of assessing the needs. But when we get down to impact, we see that impact is basically failing. We're failing at a systems level and need to work on how to improve. And I think that type of work is going to come essentially from our STEM partners. It's going to not only come from doctors, nurses, and other clinicians. It's not simply going to come from the public health space where we've addressed or looked at some of the data. We know the problem. The issue is that we've not translated the problem through different things in order to address and really have a positive impact. Sorry, there's a comment here in the chat I also wanted to address. Thanks, Alexis, for sharing with us. You work in healthcare, thank you, and investing in interdisciplinary training and mentorship, agreed, is especially needed in areas like digital health and innovation, as well as looking at the gaps that exist between many clinicians. They lack formal leadership at the systems level. I would have to agree. Many do. We're not saying all in totality. So building those skills for essentially a stronger, more effective system is spot on. Thank you for that comment. Thank you for sharing. I think looking at the disciplines of how we educate people in these spaces and help to bring and collaborate and connect in that work is really important, not just for clinicians, but I would agree with you that it's not a part of their normal training, but certainly within other spaces. I think there's an opening that we're seeing. In the past 30 years, we've seen doctors now also bridge their education with public health. So you might see someone that's a medical doctor, MD, and an MPH, but has that person also had the space to look at biopharma or technology, and also bridging some other STEM areas. I appreciate that. And again, we're thinking of, at least I'm always thinking of, the healthcare system space, the population level. We can do things in the individual level within our communities, but at population level, it's really where we see the challenges and where we see, again, as I mentioned earlier, where these areas are lacking. I wanted to also pose a couple of additional questions for you. If you had to bridge the connections, again, between public health and STEM in the next 6 months, what would that look like? And I think I would ask that maybe you come off of mute because this might be a little bit challenging to put in the chat. But if things were to change by the end of the year, in the next 6 months, where would you attack first? And we could do a lot with AI. This is not even the AI conversation here today, but I think that's going to play an instrumental role in some of this. But what are the thoughts? I'm deliberately trying to get the audience today to think about outside the box. What could it look like? Thank you. I think I missed a comment just before moving to this question that I didn't want to ignore as well. Looking at the inclusion of AI and ethics and governance along with humans and the human perspective from public health and keeping it in the loop is also important. Thank you for that additional comment. And then April, yeah, digital analytic tools have come a long way, and we still could yet go further, as we know. So it'd be difficult to keep up the speed being a practitioner, yeah. But in AP cases, in AP, like classes can be offered if we're talking about at the secondary level. I think the generation coming up now, they are much more in tune with how to apply some of the innovation that's taking place along with public health and science or STEM opportunities. But I did want to go back and thank you for again sharing that in the chat. I did want to go back and sort of think about what could things look like. I was reading some research on Parkinson's disease recently, and actually through the Michael J. Fox Foundation, and they are doing a lot. They recently in May convened this conference where they're doing essentially what we're talking about today: how to merge what we know from a clinical background around Parkinson's disease and other neurodegenerative diseases and illnesses with a public health approach, and I'm going to say a STEM approach. They didn't use that language, but trying to use the sciences and other domains and disciplines to really move forward. They're doing all the things. They're looking at AI and all the analytics. They're looking at tools. They're looking at wearables, things that are designed as warning signals. They're looking at the pharmacology, all of those. But I think it's how do we think about that on a daily basis? what does that mean in terms of converging the two? Thanks, Alexis. I'm going to read your comment here. If you had to bridge public health and healthcare in the next 6 months, you would start with data integration and real time collaboration, connecting hospitals, public health departments, and community organizations just to act earlier, right? Just to get a grasp on things and not always react. I appreciate that comment as well. We are in a reactionary phase. We look at our systems, our populations, our outcomes after the fact. And so I love that you said that. I don't know if you're a public health person, but that is essentially the distinction between public health and medicine. Public health is before someone gets sick, right? We're trying to prevent all these things from happening. And but we rightfully need our medical and our clinician traditional medicine to address sick persons. But I come from the perspective like, what if they never got sick in the first place? How do we prevent that from happening? So I appreciate your perspective too and what you would do in the next 6 months. Converge all those things. There isn't one space, nor do I think there should be, but I think also just thinking about that. Someone applying to a school of engineering may not see themselves as a public health leader or potential leader. And I would say that's absolutely untrue. I'd like to believe that all of you, in some way or capacity, are equally public health leaders, either for yourselves or what you represent in your institutions or organizations, or within your communities, even. Other feedback regarding what could happen in the next 6 months potentially if we really looked at these two areas. And the sub of this title for today's webinar is also building public health and improving STEM leaders so that we can look towards the future to do more of this. Thank you. I see the additional comment here, Alexis. Final thought in terms of the question is that you would tie into your first response is target preventive care using AI and identifying at-risk populations, and then intervening before the conditions escalate, true public health. At the same time, invest in cross-sector leadership teams. I think we have to have the conversation and bring folks to the table, breaking silos and aligning priorities. We should talk, Alexis. Like, we are having similar thoughts. I think that's really excellent. But I also want to offer in terms of where these conversations take place really matter, and they have to happen at every level. While I'm calling leadership, I'm also equating leadership at the community level. And so bringing in laypersons, I think someone made a comment at the top of the webinar, bringing in laypersons to the community. They don't have to be these experts or professionals per se that are within these veins. Parents, students, community persons, business persons. What does this mean in terms of improving our overall public health? Thank you again, Alexis, for your feedback and comments in the chat. Were there others?
And I want to remind the participants that if you raise your hand, you are welcome to come off mute and have a live conversation.
Thank you. I appreciate that. Okay. Well, thank you so much. Thank you for your comments and for participating in the chat. Appreciate that. Okay. So I think in terms of moving forward, what I'd like to offer is that we don't really have, again, a data problem. I think what we have is a translation problem and how to translate that data, again, moving through the process of where are we? What are the insights that we're gaining? And I don't want to pretend that this is very much a clinical discussion or it needs to be solely at the public health level, but I do want to push and advocate that we're thinking about these things. Again, I, I like to encourage persons to start from the individual perspective. What are you seeing in your home? What are the illnesses that are prevailing within families, within different structures? And what does that mean? Do you simply want to be a reciprocant person that goes to the clinic only and have someone tell you what medications to take? That's fine. That works. It's what we've been doing by tradition. But how do we have a more integrated as well as collaborative? I'm going to keep using that word partnership about how we address some of the public health challenges that we're seeing, that we're experiencing on a day to day basis. And where does STEM play that role? Again, I don't think I need to advocate that there is a role for STEM. I think what I'm advocating for is more conversation between our STEM leaders, institutions, communities around things like health. And then how to then move resources, attention, rightfully so, to impact, to have a positive impact and not the outcomes that we're seeing over the past few years and decades over and over again in the same communities as well. Pardon me, my hands are slower than I need them to be. Okay. So I just wanted to also just note here that we're closing up a little bit, but not the entire conversation. Our future depends on leaders who can use data effectively. And I wanted to close with this because there's so much data out there. The AI conversation has completely exploded and imploded in some ways. But what we're doing is we're sort of, again, being at the other end and we're reacting. We're reacting to the information and trying to catch up using things like AI tools to help us think through something. So if we did that, but did it from a more proactive space, it's about using the data in the ways that are going to really help us address the conversation better. I wanted to give a little bit of a case study from where I've sat. Thank you, Christine. You shared a little bit about my background. My most recent posting was in Vietnam, but I spent the last 25 years on the continent of Africa and in the Caribbean. And I've addressed mostly HIV as our major disease of interest. And what has that meant? That's meant, yes, we've addressed some things from a funding as well as a cursory data review. And so we know the trends, we know the persons, we know the outcomes. And those outcomes when it comes to HIV are a matter of life and death in many cases, life and death and medication. But what we haven't done is really look at how to encourage the right tools, the right STEM, and all four letters in order to address some of what we've seen. So the case study is this. And so I'd like for you to ponder this for a second, and then we can have a discussion before we end the conversation for today's webinar. Imagine a little girl, and we're going to call her name Izwa. Iswa is from a country in East Africa, and she is an orphan. Her parents have died. What they can confirm is at least one parent has died from HIV. She now resides in the home of her grandmother, and her grandmother has other grandchildren that also live in the home. Ezra gets her medication from the local clinic, fortunately, in that community. They're open about HIV and they're open about providing medications that are funded through their state and national programs. Ezra is now a 13-year-old young girl with all the feels, as the kids put it, right? Puberty, dealing with social friends, academics, and thinking about her future. Ezra wants to be a doctor. But there aren't many doctors, one, in her community, and certainly there aren't many female doctors in her community as well. She continues to get her HIV medication, usually in a secretive way, along with her grandmother. No one knows that she's HIV positive. Ezra is now moving into secondary school, high school, as we call it here, and she's taking her medication, one pill a day for HIV. That's how far we've come. She takes one medication per day to deal with her HIV. She's having, again, all the feels of adolescence and liking boys, and would like to, again, maintain her desire to have a dream career in medicine as a doctor. Her teacher comes to tell her that it's not really likely that she could become a doctor. She can become a teacher. She can become a community health worker to help people understand about their health. But the likelihood of her being able to proceed into such a, in that community, prestigious position or career or education without the money and the funding from her grandmother is less likely. So she's encouraged to be a teacher. And she switches her dream to just that. Still a wonderful former teacher, wonderful job, but we're pulling away from her true desires. She's interested in everything from robotics to technology and even a little bit of science. And she does quite well academically. Fast forward, Ezra is now at university studying to be a teacher. And she's again having this desire to really engage with her healthcare system, which is almost non-existent in her village community, unless she goes to a larger town, many miles, several miles outside. Why wasn't Ezra encouraged to continue to do medicine or even public health if that were to be a desire, or even science or any of the STEM fields? This is not just about sort of the issue of education in a underserved area, but we're really talking about how to dream bigger. And I wanted to sort of give you this. This is a real story. I've changed the name, of course, and didn't give you the exact country, but really wanted to change the narrative behind how we encourage education and the pursuit of either STEM or public health. And so, again, Ezra had no data. She didn't really know what was happening in her community. She didn't have all of the information, the graphs, the tables, etc. But she knew that she wanted to have and make an impact. And so today's conversation was about how to start those conversations for that impact. Again, I gave you just some thoughts around data, policy, insight, and eventual outcomes and impact, but I wanted to personalize it in a way it's how we're having conversations about public health, how we're having conversations about science, technology, engineering, and math, and where the two could converge and convene to really improve and provide innovation for the outcomes that we look for. I'm going to stop there, about 4 minutes short of where I desire it to be, and hand it back over to you, Christine, to see if there are questions or if there are things that people can discuss coming off of mute. Thank you.
Amaka, thank you so much. This was a wonderfully presented narrative, collaborative conversation we've had. I'm encouraging folks to raise their hand to come off mute, perhaps to discuss the vignette Amaka provided or to put your thoughts in the chat. We have plenty of time for Q&A. Oh, you're muted, Dr. Nwankwo.
I just saw that. Thank you. I was thanking Gilbert for joining us today, but I also wanted to hear for anyone who's willing to share. Does this resonate? Are these conversations only happening in my head amongst my public health colleagues? And we talk about bridging STEM and things of that nature. But I just wonder to what extent, even just from a very personal level, we think about our healthcare alongside the tools, the STEM tools that could be utilized and converged together. And this one I would encourage coming up with mute. It's not required to respond in the chat. If it hasn't prior to maybe today or in a very impactful way, I would encourage you to continue to have similar conversations. I really would hope that institutions are starting to talk more. This idea of, I think Alexis mentioned it, us working in silos is not benefiting anyone. It's not benefiting our communities or our work or even the funding that's sort of dwindling in a way that we have to now work a little bit more collaboratively. I'm going to go to the chat. Um, what national networks are active with regard to your comment about formalized national HBCU STEM networks? Well, we have QEM networks certainly with us today. So Quality Education for Minorities is the organization that's hosting us as Heroes Fellows. And so working together with partners that are existing partners through the QEM network, as well as those that join us on our webinars and also take part in some of the work that we do. Maybe I should say a little bit, or Christine, if you'd like to, about our role as Heroes Fellows, if that's helpful.
Well, the Heroes Fellows are really an extraordinary group of people who have come from roles in the federal government and roles as researchers, like Dr. Nwankwo is a perfect example of the kind of person that's serving in the fellows role. And I think many of these policy related discussions are especially relevant to the group of fellows that we have because there's this opportunity when we have these conversations to bridge research with policy thinking because of the experiences that the fellows have had. So our fellows are especially valuable, and they're valuable on their own merits and valuable in our program and the way it's designed specifically because we can think more strategically and broadly about STEM ecosystems as they exist across sectors and think more broadly about who in academia or in the research realm can connect with people outside of that realm to do meaningful work. And one thing I've been meaning to ask Dr. Nwankwo is we've had challenges this year for global health funding, to say the least. We've had challenges with PEPFAR and global HIV services. If I'm sitting in the position of wanting to do community health research or global health research addressing equity, what are some strategies that I can employ now to get my work off the ground and keep it going in light of the current environment, which, in the environment that we're talking about, funding restrictions and realigned priorities around health research?
I really appreciate that question, Christine. It is exactly sort of the lane that I'm coming from. I think we have to think about how we work together. Collaboratively. Again, I don't want to overuse the word, but it really is essential because we're talking about bringing minds and an interdisciplinary approach to the way we look at healthcare. And I think that interdiscipline has only been within the medical and the public health space. And I really mean this broader understanding of what it means to work together with others. The funding is what it is. It's changing, it's shifted. For global health, it's becoming almost non-existent in the ways that we understood it. Point in case, USAID, a whole agency was, dismantled and taken away because the focus wants to be more within our domestic program. That's not a problem. I think it's how we marry and partner our domestic challenge with what we see overseas, which are the same challenges, different contexts, different people maybe, but the impact is the same, and that is we're not really making the strides that we'd hope to. You mentioned PEPFAR, and that again is an HIV space, but we could talk about cervical cancer. We could talk about autism spectrum disorder. It doesn't matter really what the issue or the health concern is. I think the things that we need to do is look onto both sides outside of our own purview, as I'm trying to sort of state here in today's webinar. I think the second thing is we have to look at funding in a different way. It's not now going to come from the likely places that we've been seeing it come from over the past couple of decades. And so exploring things like philanthropic work, exploring things like community work, and what that looks like in organizations, nonprofit organizations, to take it across and outside of our borders, I think is going to be very strategic. And again, it's finding the alignment within both the positive aspects of sort of the things that work well together, but then also the alignment within our challenges. Why are we experiencing the same challenges with all of the investments and all of the technology and all of the tools that we have here in the United States and still seeing the same outcomes and impacts in various countries overseas? And what that looks like is that virtual South to South collaboration or discussions. Again, a little earlier, I said something about not just creating the table and the space to have the discussion, but bringing in multiple tables. And I don't think we do that quite as well because we've created a culture within our organizations, within our funding, within our resources, and within our leaders that looks the same. And so this is sort of my effort to have a first conversation about let's not look the same. We can't look the same way and address the problems and expect a different outcome. Thanks for that question.
Dr. Nwankwo, could you advance to the closing slide so we can keep
Apologies.
those QR codes visible to our participants? Um, Not to interrupt the conversation, but I just want to make sure that everyone is able to see these QR codes. They link you to the QEM events page where you can sign up for future webinars, the Heroes webpage, which is especially important, where you can connect with individual heroes working in your subject matter area or in your region, and our webinar feedback form where we collect additional data about what you'd like to see more of and your feedback about this webinar. But we still have time for conversation and questions.
I'm muted again. That's my thing for today. Got it. Remember to unmute. I wanted to circle back to April's both question and statements regarding her personal connections with people in public health and also looking at the secondary science, secondary health, and education areas. And I think we really need to open up. Sort of the smorgasbord, if you will, of opportunities that are not just one-sided, right? I think you mentioned April and looking at advanced placement classes for something like public health, excuse me, in high school, but it doesn't have to be. When I was teaching chemistry, for example, high school chemistry, I'm using health examples and not just sort of what we know in terms of chemistry lab work and things like that. But what does it really mean to look at chemistry from a health perspective? It wasn't very common. Hopefully, there's more being done now as we've had these long-term issues that we're looking at. But I also just wanted to encourage making sure that we're having the discussion with the younger generations in terms of looking at innovative ways to solve problems, that they're becoming better problem solvers in multiple areas that can work together and have different synergies. I see some feedback in chat. Thank you, Christine, for providing those as well for the evaluations.
And Dr.
That,
Erickson has raised her hand, so I'm going to allow Dr. Erickson to come off mute.
thank you.
Yes, thank you. Um, Amaka, there are some similarities that I think I see across many of the various disciplines, not just from a health perspective, but the general way of integrating AI into all of our disciplines are something that's a challenge for everyone right now. And so I think that just having that synergistic discussion across the various disciplines are really important.
Yeah.
In terms of the classes, and I said it was a kind of a typo. So I didn't necessarily mean AP classes for high schoolers,
Uh,
but I thought, yeah, that is a possibility for sure.
yeah.
And I think that a conversation is occurring in those classrooms, particularly about how to use AI in a credible way, where students are
Yeah.
still learning the skills they need to communicate, but also using it to think about how could I do, say, my data analytics, right? People often think, oh, students are just going to use it for writing their essays. Um, but for crunching data, I think that could actually move the needle quite quickly for um, doctors, as well as lawyers, as well as astrophysicists, because you now have this really sort of capability to look at large quantities of data in a lot faster manner. And so I often am a person that likes to get out in front. And I thought, let's have that discussion with my budding daughter, who's this senior, now going to enter college. And I'm like, you've been this robotics kid. She did first Lego robotics. She's done other competitions. And I said, let's talk about the sensors and detectors that you used on the robots and could they be wearable technology for the future? And I think there are so many aspects of how we teach our children some of these skills, but they don't really always see how they can use that in the next phase of their development. And she's gone totally from sort of the what we consider the hardcore STEM to now a social scientist, although she says psychology, mom, is a science, and I agree with her completely. So I just wanted to add that AP was really apt.
Oh,
And it
oh,
was for the
okay.
clinician to learn what is the most viable and usable application software in their discipline. And could it be streamlined from a systems engineering perspective? How could we streamline that process so that it would be as simple as advocating to, an AI voice to say, hey, these are all of my appointments for the day. Can you now begin to formulate, put them in the right notes and things of that matter so that you could really streamline a clinician's daily work, but also help them to begin to identify upcoming potential problems with their patients, put a watch on particular patients based on the feedback or the discussions they had, whether that's psychology or physiological, I think were just my thoughts.
I did not plant Dr. Erickson, I promise. Um, I had someone tell me once that I was a closeted data scientist, and that's because of my work in epidemiology. And he's like, you're using the same tools to do data science. And so, April, I would say that you're probably a closeted public health professional, or at least an advocate for your daughter. And I absolutely love that. Everything you said were just beautiful examples of just having the mindset in terms of thinking beyond, right? An app that would improve the clinic flow, an app that would assist a clinician with a better understanding of a wearable from a patient and how they are managing stress in addition to coming into their clinic for some other challenge. And I think this is really the conversations that I would like to continue to bud and advocate for this kind of work. But it can't happen if we're only thinking about engineering in one way, and in one discipline versus how to now use it also in public health, et cetera. So thank you so much for sharing that. We can talk offline a little bit more, and hopefully the rest of you also will have an opportunity to sort of spin your wheels about what that could look like and what it might mean. Appreciate it.
Thank you so much to all of our participants today for a wonderful conversation, interactive conversation. Dr. Nwankwo, this was a model of how to have a collaborative discussion in the webinar space, so thank you.
I appreciate it. Thank you all for attending. So does this now end our webinar? I'm very much open and still available for any thoughts, questions, insights from others. I brought my perspective, but please, the value in this is the perspective that all of you bring from where you sit as well.
Dr. Gibson, you have your hand raised.
Yeah, thank you, Christine. Dr. Amaka, thank you for this amazing presentation. It kind of took me back because my I started my career and my undergrad was in public health. Well, that's what I studied and had experience in the field years ago. And I continued to do a little work in health com and mental health, of course. But as my career has largely shifted into education leadership and policy and grant strategy, et cetera, over the past decade. But just listening to your presentation was so inspiring. So I would say if I even wanted to consider reconnecting with the field in a very meaningful way. Just listening to you, which, like I said, was inspiring. What would you suggest that where we would a person like me would start in today's landscape?
Thank you, Chaz, for sharing that. I think that's essentially what I would love to leave everyone. It's where you sit. You do not need to now find yourself in public health spaces. It's in the spaces that you're in. It's in the education spaces that you're in. It's in the science spaces. It's with our heroes fellowship and the institutions that we come into conversation with. As we provide technical assistance and have discussions on so many levels with different potential collaborators, it's sitting down and saying, oh, okay, so you're working on trying to ascertain additional funding in the STEM space around biology. Have you looked at like where biology is in certain, health spaces? I used to work in public health and I know there's a lot going on. It's starting the conversation. You don't have to end the conversation. It's about starting the conversation, right? Just
Absolutely.
as you just did here in sharing with us during this webinar. But it's where we're having these conversations. So if you're privileged to have these conversations amongst administrators, faculty, and other leaders from an institution, and that's what we want to do, multiply it at a higher level, at an institutional level, for them to just start thinking. I think that's where you start. You start right where you are. And that's for everyone on this call. If you're working in churches, you start right where you are with the pastor. If you're working in mosques and in businesses and in barbershops, you start right there. Did you know that there's a science behind what you're doing, cutting my hair right now? And so the science behind you using the clippers, et cetera, et cetera. But if your clippers aren't clean, like what does that mean from a public health guys? How many people do you clip in a week? And starting the conversation right that's all the collaboration that we're talking about and seeing where it would go from there. I really appreciate your comment, Chaz. Thanks so much.
Thank you for the response. Beautiful.
Thank you so much, everyone.
Thank
We
you.
are
Thank you,
about at
everyone.
time, so I want to thank Dr. Nwankwo again.
Many thanks to you, Christine, and for all of you for joining today. Really appreciate it.
Have a wonderful afternoon, everyone.